A new report from the American Lung Association shows Indianapolis is one of the worst American cities in terms of air quality, and it gives Marion County's air quality an F. We now welcome Mike Seilback with the ALA. Thank you for joining us. So why does this air quality grade even matter? What is the impact?
So this year's report shows that the Indianapolis area is failing for all three of the air pollutants that we measure for. And what that means in real world terms is that far too many residents are being forced to breathe unhealthy air.
And by breathing unhealthy air, what would be the health effects of that?
So we look at two pollutants, ozone and particle pollution, and each one of those pollutants could lead to wheezing, coughing, asthma attacks, heart attacks, and they could even cause premature death. Literally, exposure to this level of air pollutants could shorten someone's life because of that exposure.
So what's causing this, and is there a solution?
So it's a mixture of things that cause the air pollution in this area. We have obviously vehicles, industry, local power plants. But this year's report really showed that wildfires from Canada had a major impact on the entire eastern seaboard of the United States. And so it is a mixture of both locally produced pollution and pollution that comes to our area. But it should be a wake-up call that says we need to make sure that we have a well-funded and well-staffed federal EPA to ensure that we're being protected from the air we breathe.
So obviously environmental policy is a part of this, but if our current air quality is an F, what role does health coverage play? The American Lung Association is actively pushing against cuts to Medicaid. Why is that?
The fact is that there are proposals right now in Washington that are going to kick people off their health care. We see that we also see that in the states, but we need to make sure that people have the health care they need. This air pollution, as I said, can get people sick. And if you don't have adequate health care, you could literally die. This is a life or death discussion. And cutting Medicaid is not the solution to saving dollars on our federal budget.
Yeah, and while many expect federal Medicaid cuts, Indiana has already taken steps to lower Medicaid enrollment. In your view, how will this affect health outcomes, especially in light of this air quality report?
We all know someone that is impacted by unhealthy air. It could be kids, the elderly, people that are pregnant, have cardiovascular disease or diabetes. And we need to make sure that everyone is being protected, and making it harder to stay on health insurance is simply a policy that doesn't make sense. We should be doing everything we can to protect our residents, not make it harder to stay on health care.
Mike Seilback with the American Lung Association, thank you for joining us.
Thanks so much.